that portion of the brain which controls the upper and the lower limb on one side, because the brain has two portions, the right brain and the left brain. And the left brain controls the right side of the body and the right brain controls the left portion of the body. So in case there is lack of blood going into the parietal lobe on the right side of the brain, then the left upper limb and the left lower limb cannot be moved, and that is called the left stroke. Similarly, there is a right stroke. So now why this happens? I am Dr. Muralidhar. Now let us know about stroke. Many of you have heard in your family, you may be telling that an elderly person had a stroke and is now bedridden. Very, very important, because stroke is nothing but, in common man's language, we call it as paralysis. Means the brain, certain portions of the brain is not working. Now, we all know that the brain is like the super controlling power for the entire body. So various portions of the brain control various functions in our body. Like, I am able to see a person through my eyes. It is all happening through a portion in the brain which we call as the occipital lobe. Similarly, the upper limbs and the lower limbs are being controlled by a certain portion of the brain which we call as the parietal lobe. So now the brain is very important organ for a person, for a human being. Now the brain functions using blood. The blood is very, very essential for brain, and one important aspect we have to know in this is God has not given any storage of energy for brain. So what it means, the brain is getting blood with every beat of the heart, and every beat of the heart is important for every portion of the brain to work. Now imagine there is no pressure generated by the heart, adequate pressure generated by the heart, or the brain does not get blood for some time, for a minute or a two, then there is a danger, because that portion of the brain which is not getting adequate blood or which is not at all getting blood tends to die. So the brain cells become dead, means then they don't recover at all, because there is another bad quality of brain is, if a brain cell becomes dead due to whatever reason, it won't recover. So we need to understand all these when we have to understand what is stroke. So now that portion of the brain which controls the upper and the lower limb on one side, because the brain has two portions, the right brain and the left brain. And the left brain controls the right side of the body and the right brain controls the left portion of the body. So in case there is lack of blood going into the parietal lobe on the right side of the brain, then the left upper limb and the left lower limb cannot be moved, and that is called the left stroke. Similarly, there is a right stroke. So now why this happens? Because that we call it as a brain attack. The blood to the brain is going through two important blood vessels in the neck. They are called carotid arteries. Now these carotid arteries also can have blocks, and the blocks can be due to diabetes, cholesterol, triglycerides, atherosclerosis, smoking. And so these are the reasons for blockages in the carotid arteries. In the initial stages, the carotid arteries produce small clots and they go into the brain and they cause TIA symptoms, that is Transient Ischemic Attacks symptoms. Means the person can suddenly become the blackout, and then he may have giddiness, he may fall down, or he may temporarily have paralysis in the upper limb or in the fingers, which is early symptom and which is very, very important to note, because later he may have a frank stroke So to prevent frank stroke, these symptoms have to be observed. So we have to observe the symptoms of TIA, transient ischemic attacks, which are produced because of producing small clots in the carotids, which go into the brain and cause these symptoms. So we should know what is happening in the carotid arteries. So in such patients, we should screen these carotid arteries. What do we mean by screening? These carotid arteries can be seen in color Doppler tests like ultrasound, or we can even do an angiogram of the carotid arteries to know what is happening within the carotid arteries. By any chance, if there are blocks within the carotid arteries, we can treat them and avoid the person developing stroke. Now, imagine if there are blocks of more than 75% in these carotid arteries, we have to treat. Now, we have two options of treatment. One is a balloon angioplasty and stenting. We can do stenting of even the carotid arteries. Many times we also do surgeries. What surgeries? We call them as carotid endarterectomy. So we go there, open the carotid artery. When we open the carotid artery, we can see the blocks inside the carotid artery, and then we remove them. These carotid endarterectomies can be done even under local anesthesia, and it is advantageous. You know why? Because the patient is awake. And when we are doing surgery on the right carotid artery, we ask the patient to keep a ball in the left hand, and we keep asking him to move the left hand. And when the ball is pressed, the ball makes a noise. And we know that as we are doing the surgery, as we are proceeding with the surgery, the left upper limb is active and it is not going into weakness. So we can keep asking the patient to press the ball and make the noise, and then we keep operating under local anesthesia, and then we complete the procedure without causing any harm to the portion of the brain. So we re-establish adequate blood flow, and we avoid or we prevent the patient from developing a frank stroke. So this is called carotid endarterectomy, which is a very, very important and a major surgery, but of course is important from the point of view of the patient who can be given or that option of not developing a stroke. So one should know what is a stroke, how to prevent a stroke, and how to treat a stroke which a patient can develop later on using a carotid angiogram technique. Thank you.